Well, thanks very much. And as I was casually saying, it's really nice to see everyone in person. As everyone is aware, this fourth wave has been very challenging in many parts of the country, and in some places, community transmission of COVID-19 remains out of control, and hospitals are at or above capacity. And I know that many Canadians are really scared right now about what this means, not just for our healthcare systems, but for their own access to healthcare, their own pressing health emergencies. And we also know that Canadians are tired, and I think everybody wishes that the pandemic was over. And I certainly share those feelings, but as we've seen over the last year and a half, we have to keep going, and the best way to continue to fight the virus is to fight together and to stand together against the virus. Je veux assurer les Canadiens et Canadiennes que le gouvernement.
I want to assure Canadians that the federal government is here for you, and we have your backs. We are providing surge support to parts of the country that need it. And we stand ready to help other provinces and territories wherever help is requested.
Currently, the federal government is providing support to a number of areas of the country. In the Northwest Territories, with RFAs that include the Canadian Red Cross and the Canadian Armed Forces, assisting with health and human resources and in shelter operations. We're also in a number of provinces assisting with surge contact tracing support, and these are resources that can be accessed from StatsCan. We're providing funding for the operation of safe and voluntary isolation facilities in many sites across the country. And we are supporting with testing with the National Microbiology Lab and a few other federal labs that are helping with any surge capacity. And as has been previously reported, we are providing offers of assistance in our discussions with Saskatchewan and Alberta for health human resources, PPE, medical equipment, vaccines, testing, and anything else. As confirmed last night by my colleague Minister Blair, the Canadian Red Cross and Canadian Armed Forces will be assisting soon in Alberta, and I'm pleased to hear support from Newfoundland and Labrador will also be accepted. Officials in my department and over at Procurement Services Canada will continue to work with both provinces on their requests. As I indicated to my ministerial counterparts provincially, it's very important that we plan ahead for these challenging scenarios, as some types of help are easier to coordinate than others. For example, vaccines, test kits, personal protective equipment, medical equipment, and other things can usually be moved within 24 to 48 hours. But it's health and human resources. That's where the crunch really is, because of course these are people, and it takes time to figure out how we can move them around and get them to where they're needed. And the more time that we have to do that, the easier it is to deploy people if and when the time comes that they are necessary. So we all have a role to help with this fourth wave. And of course, the most effective way is to get vaccinated. If you haven't been vaccinated yet, or you have someone in your life who isn't vaccinated yet and is hesitant, please help make sure they get information that helps them make that choice to protect themselves, their families, and their communities. But we can also continue to follow the public health measures that we know are helping. To wear a mask when we're in gatherings, to avoid large gatherings or higher risk scenarios. And of course, if you're in an area where there is a high number of COVID cases, maybe it's time to not attend that outdoor gathering or indoor gathering. Maybe you make a decision to move an event to the outdoors to lower the risk. Every decision that we make right now can reduce the risk, stop transmission of cases, and it does make a difference. Thank you also to the 81% of eligible Canadians who have already been vaccinated. Globally, we have shown the progress that Canada has made on this front, but of course, we still have a large number of people who have not been vaccinated and who cannot be vaccinated. So again, if you are one of the folks that has not yet taken advantage of this life-saving medication, please do so. If not for your health, think of the teachers, the mental health of school children who are so desperate to continue to stay in class this year, or the small business in your community that just can't afford to even fathom another period of inactivity. The faster and the more that we get vaccinated, the faster we can defeat this fourth wave. I know many of you are also eager to know when vaccines might be available for those under 12. We're waiting right now for the companies to submit applications for the 5 to 11-year-olds. And once the application is received, Health Canada is in a very good position to quickly proceed with its thorough review. And so to parents, I know it's been an extremely challenging time. Many parents are still working from home, still homeschooling, providing full-time daycare while also holding down a job, worrying about your own mental health, your children's mental health. And I want to recognize the extra burden that the pandemic has placed on you and your family, and to thank you for everything that you're doing to protect yourself and your communities and your families. Finally, we all owe a huge debt of gratitude to the frontline workers. The doctors, the nurses, the paramedics, the social workers, the respiratory technologists, and so many more, the medical professionals who are dealing with what is likely the most challenging time of their professional careers. And I can confidently say on behalf of all Canadians, we're extremely grateful for your dedication, for your commitment, for your compassion, and for keeping all of our healthcare systems running and supporting the well-being of all Canadians. So thank you, merci, miigwech. And I'll take your questions.
All right. Thank you very much, Minister. We'll start. Nous commençons avec 3 questions par téléphone et après ça, 3 questions dans la salle ici. We'll hand it over to the operator.
Thank you. Merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. The first question is from, la première question est de Sharon Kirky, National Post. Please go ahead. À vous la parole.
Oh, hi. Thanks so much for taking my question. Minister, Alberta and Saskatchewan this week requested doses of the Janssen vaccine in the hope that it would increase vaccination uptake among those who do not want an mRNA vaccine. Should this option not be available to other Canadians? I'm wondering your views on that.
Well, thank you for the question, and we are working right now on those requests and have also offered an option to all provinces and territories who are interested in acquiring doses of Johnson & Johnson. We will be trying to provide those doses as quickly as possible to the provinces that are currently seeking them. But as I said, the department right now is scanning with all the provinces and territories to see if there's a demand in other regions of the country.
Okay, and one other question, if I may, and it's around the children and the Pfizer vaccine for those under 12. You did mention that, you will be reviewing this and proceeding, but, we're hearing reports that it could be approved for children in the U.S. Within the coming weeks, which means children in the U.S. could be start getting vaccinated by Halloween. Yet it could be, end of year, early 2022 for Canada. I'm wondering why there could be such a delay here.
I'm not sure I have the same information as you. We do anticipate that we'll have an application in the weeks to come from at least one of the 2 companies. And as soon as that application comes in, the regulators are well situated to very quickly review those applications. We've added millions of dollars to the regulatory body so that there are additional scientists and analysts that can and that do work on a 24-hour, 7-day-a-week basis. So we're very well situated, as I said, and those conversations with the corporations are ongoing right now. So we'll have to wait and see how quickly the company applies to Canada. Certainly, I know those conversations are happening, and when they do, we'll be able to quickly review the data and approve when thoroughly demonstrated as safe.
Thank you, operator. Next question.
Thank you. Merci. The next question is from, la prochaine question est de Catherine Lévesque, La Presse canadienne. Please go ahead. À vous la parole.
Oui, merci beaucoup. The Prime Minister this week put out 5 key priorities in terms of vaccination. I was wondering if we could get a sense of how quickly the government is committed to implement mandatory vaccination for the public service, but also passengers on trains and planes. And when are we going to have more specifics on how this is going to work?
Well, thank you. And I share the Prime Minister's urgency in those objectives. And I'll say that I know those conversations are happening right now in terms of the federal public service with obviously the employers, but also the unions to make sure this happens in the right way. And in terms of passports or proof of vaccination for domestic travel, my understanding is that Transport feels this will be possible by the end of October. So we're moving as quickly as we can on both fronts. Again, to provide people safe workplaces and to provide safety for individuals that are traveling within Canada.
Any idea when we would have specifics? I think the Prime Minister was talking about the next few days, but if ever you have more information on that, that would be appreciated. My second question was, about the cabinet that's going to be announced in the next few weeks. I was just wondering if you were hoping to stay on as Health Minister.
Well, thank you very much for the question. It's first of all just been an honor to serve with Prime Minister Trudeau for the past 6 years in his cabinet, and I will serve this country in any way that he asks me to do so. It continues to be a privilege to be a member of Parliament and to be a Minister of the Crown.
Okay, thank you, Operator. Next question.
Thank you. Merci. The next question is from La prochaine question est de Zach Vishera, Saskatoon Star Phoenix. Please go ahead. À vous la parole.
Thank you very much for taking my question. Minister, I know that you had a conversation with Minister Paul Merriman in Saskatchewan about a potential request for federal aid last week. I understand that Premier Scott Moe also spoke to the Prime Minister about what Saskatchewan might need earlier this week. I'm wondering if you've received any more specifics from Saskatchewan on what they may require to deal with a rising COVID-19 hospitalization rates, and if an official RFA, a request for assistance, has indeed come in at this point.
Well, thank you for the question, Scott. So far, we have not received an official request for assistance from Saskatchewan, although Minister Merriman and I did have a conversation about some of the requests that the province likely will have. We do know that he's asked, for example, for additional monoclonal antibodies, and they have some already, so we're working on the details of what that further need might be. Certainly, a request for assistance will help clarify more quickly exactly what the province is looking for and how we can best help them meet those needs.
Thank you. And a follow-up, if I may, on those monoclonal antibodies. The Premier and the Health Minister in his letter to you were quite bullish on those and said they wanted to see those used much more widely in Saskatchewan. Similar to what is happening in the United States was the analogy, the comparison the Premier used. I'm wondering if Health Canada has an adequate supply of these antibodies to do that. I understand they're expensive. And I'd also like to know if there are any cautions around their use. I understand they're recommended right now for a very select group of patients.
Well, I think the questions around the appropriate use of the treatment would be best left for Dr. Tam, and she'll be here after me. So I'll leave those questions to her around the appropriateness of use and when. But I will say in terms of the supply, we do have a supply in Canada. We also know that Saskatchewan has a supply. And again, once we understand the degree to which they propose to use these antibodies and their and the timeline, we'll have a better sense of how we can meet the need.
Okay, thank you. And I will take questions in the room. If we can alternate the two microphones. I don't know who is in first, but we'll start over there and come over here.
Hi there, Minister. Travis Stanraj, CBC News. Thank you for taking our questions today. Minister, I just got an email from the Chilliwack Progress. This is just published in the Chilliwack Progress. It's a picture of the Prime Minister relaxing on a patio yesterday with a beer next to him. Many Indigenous people are outraged the Prime Minister traveled to the beach in Tofino to be with his family on the first National Truth and Reconciliation Day, rather than, for example, accepting an invitation to visit Kamloops, which he flew past. What's your reaction about the message that sent to Canadians, specifically Indigenous Canadians?
Well, all I can speak to is my experience yesterday, and it was truly a profound experience. Of course, I have heard many times before, especially in my riding of Thunder Bay Superior North, stories of people who are residential school survivors. But on this first National Day of Truth and Reconciliation, to see the community come together in such a large way to listen to the stories of Indigenous people and to commemorate, in our case, the site of a former residential school, to listen to the chiefs and the various individuals and elders share their story was very, very moving, and it was an honor to participate. And so for me, this day will have a profound legacy for Canadians and for Canada. And I think of the words of the newly sworn in Governor General, Mary Simon, who reminded us all that reconciliation is indeed a journey, and that what we're doing as a country and as Canadians right now are planting the seeds of a garden for our children. And I thought it was the most beautiful way to summarize what this National Day hopefully will become for Canadians.
Thank you for that, Minister. You didn't address the core of the question about your reaction to the Prime Minister being on a beach in Tofino, but I do have to ask you about something else, and that is the Merck pill that has been, they've requested it for emergency authorization in the United States. I know that that's in the approval process right now with Health Canada, but would Health Canada consider emergency use of this pill for COVID-19?
So we have a very different process of approvals than the United States, who has an emergency approval rather than a rolling regulatory approval process that we implemented at the beginning of the pandemic. So, for example, you may have heard in the U.S. the debate about emergency use authorization of vaccines and other medications versus permanent use authorizations. We don't have that distinction here in terms of the ways that we've been doing approvals. The best person to speak to about this, though, in detail would be Dr. Sharma, who will come on afterwards and is the head of our regulatory body. And I'll just say that, again, the regulatory body of Health Canada is extremely well positioned to do very rapid rolling reviews. And they don't stop once the approval is received. There's an ongoing data and safety check that allows for Health Canada to be able to change, for example, instructions of use, or in worst case scenario, revoke use for specific medications or devices. So I'll let Dr. Sharma add more detail when she speaks with you.
David Aiken, Global News. Congratulations on your re-election, Minister. I want to pick up on something Travis talked about. I noted you yesterday, many your cabinet colleagues participated in a reconciliation event as you probably wanted to walk down the path of reconciliation and the Prime Minister wanted to walk down a beach. Does that not set back efforts to reconcile when Indigenous leaders look at the Prime Minister and they don't see him setting example that you and your cabinet colleagues set?
Well, I think what I heard from the Indigenous people that I spoke with, including former Grand Chief Alvin Fiddler, as you know, and Deputy Grand Chief Annabette Ashni-Pinescom, and many other Indigenous leaders that were at the event yesterday in Thunder Bay, Ontario, was the historic enormity of a day that recognizes the ongoing colonization that Indigenous people face. It was obviously focused heavily yesterday on the experience of residential school survivors and their families and the historical sort of trauma. But I think there's a broader acknowledgement that it's also about the ongoing ways that Canada perpetrates that trauma on Indigenous people. And so for me, it's hard to put into words how moving that day was and how moving it was to see so many citizens out meeting with Indigenous people and hearing stories that I know for sure some have never heard before. And to me, that is reconciliation. It's relationships. It's not one day. It's not a T-shirt. All of those things help to raise awareness. But I said this in the campaign, and I truly mean it. And I said it yesterday in my remarks, that reconciliation is just a word if it's not built on relationships. And that the best way to reconcile and to begin to reconcile is to get to know the Indigenous people in your own community, one by one, family to family, colleague to colleague. And so I'm really, really proud to be part of a government that has helped with so many opportunities for Canadians to do that.
Probably a lot of people agree with you. And I think I know the answer I think I know what you might say, but I'm going to rephrase the question. It was a statutory holiday. You could have taken the day off. You could have taken the day off, as some in your cabinet did, one particular person, but you chose not to take the day off. Why did you decide not to take the day off yesterday?
Well, I can't speak to other people's scheduling. I know the Prime Minister was at an event the evening before with survivors, but I honestly don't have the details of his schedule. I can just speak to mine, as I have, which is that I was invited to an event. I was able to attend, and it was an honor to be there. It's an honor, and it's an interesting opportunity as an elected official to meet with Indigenous people in our communities, as I know the Prime Minister does, by the way, all across the country, to hear what more we need to do as a country. And there is so much more that we need to do. And so to all Indigenous people across the country who shared their personal stories and wept and allowed themselves to be vulnerable, to share those incredibly painful stories, thank you. Thank you. I saw you. I saw you on TV. I saw you in person. And I personally know that this journey is just beginning.
Kevin Gallagher, CTV National News. Minister, as you mentioned, we're grappling with the fourth wave, and in many parts of the country it's heading worse than others. In Saskatchewan, Alberta, and British Columbia, they're asking for more of the Janssen vaccine. I know you were asked about this earlier. How many doses does Canada have on reserve? And is this the type of strategy you think that is necessary now? If there is vaccine hesitancy for mRNA, is that the right way to combat it, by offering some people a different vaccine?
Well, for part two of the question, I'll just say we've always said that we'll be there for provinces and territories with the tools that they determine that they need in their fight against COVID-19. Obviously, this is a medical decision, and I know that Dr. Hinshaw will have guidance. I know that Dr. Tam is working closely with her colleagues, her Chief Public Health Officer colleagues across the country. And so I will trust in the decision of the scientists and the doctors who will make those difficult decisions. And in terms of whether or not we have doses on hand, currently we don't have usable doses on hand, and so we're looking for additional doses so that we can get them very quickly to the provinces and territories, although we do have contractual offers, as you know, with the corporation.
The fact that Canada doesn't have usable doses, is that because of, just maybe remind me, because I'm trying to trace it all. There was the issue with the factory in Baltimore, right? The production facility. Why do we not have usable doses now? Because, as you mentioned, Canada does have a contract with Johnson & Johnson to have a certain amount. So perhaps you could enlighten me as to why we don't have those doses now when provinces say they need them.
Well, first of all, the regulators will never approve a product to come into Canada until they're completely safe for use. And so, as you know, the regulatory process is not just the vaccine itself, but also where the vaccine is manufactured, right down to the various lots and batches of vaccines. And that work is underway right now. There are a number of options, and I believe my colleague, Minister Anand, could speak more clearly about all those options, but there are other plants and options that we're exploring as we speak in terms of where we can access doses. And as I said, we'll be working on this very quickly so we can get them as quickly as possible to the provinces that wish to use them.
All right, thank you. We'll take, we'll do two more questions on the phone and then two questions in person if we can. Operator, over to you.
Thank you. Merci. The next question is from La prochaine question est de Louis Blouin, Radio-Canada. Please go ahead. À vous la parole.
Bonjour, Madame la Ministre. Ask you about a mandatory vaccination of the public servants. In your view, for mandatory vaccination to be efficient, should a proof of vaccination be requested?
If I understand the question correctly, you're asking if a proof of vaccination should be requested for a mandatory vaccination program. Did I understand that correctly?
Yes, exactly. Is that for the mandatory vaccination to be efficient? Should a proof of vaccination be requested?
I think listen, I think, Louis, thank you for the question. I think the operational details will vary from office to office. I can't really speak to that. I'm not involved in the design of the operational details. As you know, different places have different sizes of offices. For example, in our office, my small office in my constituency team, there's about 10 people. They've all shown their proof of vaccination, which I have asked for as an employer, and now they have, and I don't need to request it again. So I think it is an operational detail that we can certainly come back to you on.
Okay, next question about the third doses. Some provinces, as Quebec, suggested that there would be a third dose for older people. NACI recommends a third dose only for immunosuppressed people. Do you think this definition or recommendation should be, widened? Do you think that could be coming?
That would be a good question for Dr. Tam, who will come on just after me. As you know, my job as the Minister of Health is not to second guess the professionals and medical experts that are making those decisions, but to enable them to make them as quickly as possible with resources, whether it be money or people or other resources that they need to make those decisions. We've always said that it is science that will lead the way. And so from our perspective at the federal government, we support the work of NACI. We support the work of the Public Health Agency of Canada, but I would encourage you to ask Dr. Tam that question because she may be able to shed more light on it.
Okay, thank you. Operator, next question.
Thank you. Merci. The next question is from La prochaine question est de Ryan Tumulty, National Post. Please go ahead. À vous la parole.
Yeah, Minister, earlier this year and before you've suggested that there will be some manner of review of the government's performance during COVID. I'm wondering if you can give us more details now that the election's over and behind us about what shape that review might take and when will it move forward.
Well, thank you, Ryan. And you're right. I've been really clear that I not only hope that there's a review, I would expect that all countries do a formal review of their pandemic response. I think we've all had a lot of lessons that we've learned, and there are a lot of things that we could, as a nation, but certainly as a globe, do better in any other health threat that we will undoubtedly face as a world and as a country. In terms of details about how that might unfold, there have been a number of reviews already. As you know, the GFIN, the Global Public Health Information Network, underwent an independent review, and there's a report on how to bolster GFIN here. Those kinds of things, I think, are pieces of what I believe we need to do, which is a national review. And I really can't speak to the timeline. As you know, we've just been re-elected as a government, and so I will be working with my colleagues to determine how that is most appropriately done.
Yeah, and just on the situation in Alberta and Saskatchewan, you talked today about the federal resources that you're providing, but there's a lot of concern that Alberta is not doing enough to limit the number of new COVID patients that it is seeing. Obviously, federal resources are finite. You can only offer so much help to them. Are you concerned that the Alberta government isn't doing enough to ensure new patients don't just keep flooding into ICU wards?
As the federal health minister who has been on this file for the last year and a half, almost 2 years, I would say that case growth is always concerning. That when we see people getting sick in high volumes, we know that means that a certain percentage of those people will become hospitalized, and yet another percentage of those people will become so severely ill they need ICU, intensive care unit resources, and then of those, some people will sadly die. So I think we all need to be doing what we can do to reduce the spread of COVID-19, and we have the tools at hand now. We know what works, and we know that the sooner that we can reduce that spread, the sooner we can put out the flames of COVID-19 in these outbreaks. So that is why my remarks at the top of this press conference really stressed to Canadians, and particular Canadians in areas with high COVID transmission not to take the virus lightly, even those people who are vaccinated to be careful, because of course there's a higher risk even for vaccinated people. If there's a lot of COVID in your community, then there is an elevated risk even for vaccinated individuals. The goal is really to have as little COVID as possible in our communities. Some people would say we should have no COVID. Perhaps that is achievable, but I do know that working together we can keep those case numbers down. And I want to give a special acknowledgement to the Thunder Bay District Health Unit, my own health unit, who has achieved a 90% first dose, 83% second dose, maybe it's higher now, immunization rate, which has really, really helped, but also the ongoing cautiousness around public health measures to make sure that people are continually communicating how to reduce those risks. And it really is on all of us. We have to act together. This virus exploits the differences amongst us. It's an opportunity if we act together to reduce those numbers, which, by the way, are actually people that are getting sick. And finally, I'll just say this, it's scary to think that the highest case growth rate is in the 0 to 19 age category. So think about that. The people that are the most likely to get sick right now are our children. So we do need to do everything within our power individually to protect the kids in our communities.
Merci. Nous avons 2 questions ici dans la salle et après ça, le temps pour une dernière question par téléphone. Christy, over to you.
Hi, Christy Kirkup with the Globe and Mail. Just respectfully to go back to the Tofino situation for a second, why can't you say anything about the Prime Minister's decision to do what he did yesterday?
Well, I think I have answered the question. And I think that, again, to talk about yesterday, the most important piece of yesterday was the voices of Indigenous survivors. I'll just bring us back to the stories that were shared and the incredible coverage throughout the national media of Indigenous voices and the number of people that stepped up from communities across the country to listen to those voices. That's the importance of yesterday. And I don't want it to get lost. I want to make sure that when we talk about the National Truth and Reconciliation Day, that we're honoring the voices of Indigenous people. That's what it was about. It was about listening to the voices of Indigenous people, reflecting on the trauma that Indigenous people have faced in this country since contact and continue to face in many respects. And I want to make sure that those voices are heard first and foremost.
Respectfully, Minister, the reason that I'm asking you this question about what the Prime Minister did is because he took a decision to take a trip to Tofino, and some people, including Indigenous leaders and experts, are saying that this is drowning out the voice of Indigenous leaders and survivors on what was a very solemn and important day for the country. So does that make your job as a government harder, the signal that this sends to Canadians about the commitment to reconciliation?
Well, what I saw in my community was a commitment to reconciliation. The number of people that were at the events, the number of people that shared their own personal stories, including Indigenous people, the reckoning that so many communities are having around the impact of a colonial history that has been so damaging to Indigenous people. It's our first ever National Truth and Reconciliation Day, and it is a legacy. It's a legacy for this country. And again, I think the person that said it the best was the Governor General when she said, we are planting the seeds of the garden for our children and grandchildren. I can't think of a more beautiful way to describe what this work is all about.
Mike Blanchfield, Canadian Press. Following on your comments about children and risk earlier, why haven't the companies submitted their data to Health Canada yet? I mean, are you concerned about a delay in that? Is it because the government wants more information or a higher data sample or something else? Can you elaborate on that a little bit?
Those questions will be probably best put to Dr. Sharma, who will be here shortly, but my understanding is it's not a delay of data or any kind of snafu, if you will, with the companies. There are ongoing conversations with the companies, and we anticipate we'll get that submission in the very near future.
And now that 80% of people over 40 are fully vaccinated, and there's been a large uptake in 18 to 39-year-olds, what can the government do to target younger people who aren't getting vaccinated? And at what point can you say you've come far enough?
Right. Well, of course, the more of us that are vaccinated, the less foothold the virus has to infect people who are unprotected through lack of vaccination. And so for me, obviously, we want to get as many people as protected as possible. In terms of what we can do, we've been a partner to provinces and territories, as you know, on vaccination, not only through the purchase and acquiring of vaccines and distributing them to provinces and territories and making sure that that's available without any worry about the financial aspect of that. So this federal government continues to do that, really on all equipment, by the way, PPE, therapeutics, medical equipment. But we also have run ongoing media campaigns. We've funded innovation challenges for not-for-profit groups that work with a variety of different segments of our communities, whether it be unionized workers, multicultural groups, people with language barriers or other barriers. And we'll continue to be there to partner with provinces and territories so that they can get the job done.
Okay, and we have time for one last question on the phone. Operator?
Thank you. Merci. The next question is from, la prochaine question est de Jamie Moricher from Global News. Please go ahead. À vous la parole.
Hi, Minister. Thanks so much for taking my question. I just have two quick ones. One being, are you able to tell me exactly when Alberta can expect that human resources help? I know you said 24 hours for PPE and stuff like that, but a little longer when you're sending people.
Yeah, we're working right now with Alberta on the details of exactly what kinds of professionals they need and where. So as soon as we have the granular details through the RFA process worked out, then we'll be able to begin to deploy.
Are we talking a week or less than?
It depends on the details from Alberta. We are waiting to hear who they need and where and what kinds of professionals. And as soon as we have that detail, we'll begin to put together the plan on how to get them to the province very quickly.
Okay, and then my follow-up to you is back in August, the Premier of Alberta said that he didn't need a lecture from you when it came to handling COVID-19. He's kind of pushed off help from the federal government up until accepting it yesterday. At this point, the province is kind of past the tipping point, according to frontline workers. Do you wish, or is there a way, I guess, that the federal government could have stepped in a little bit sooner? And are we waiting for things to get worse in Saskatchewan, or, it's kind of on the same trend where we're putting off the ask for help until what?
Well, the letter was sent because, of course, from the people that advised me at the Public Health Agency of Canada, there was a high degree of concern around the measures that Alberta was proposing dropping at the time. And there was modeling that showed by Dr. Tam and the Public Health Agency of Canada that if we, even with vaccination, released measures too quickly, we would see a resurgence. And that's exactly what we have seen. In terms of the requests for assistance, I can't speak to their processes. I can say that the offer has been ongoing. Even during the election, the officials were working every day with the officials from provinces and territories to make sure that they knew those requests could come in at any time and that we would work to fulfill them. And that's exactly what we're doing with these requests. So all I'll say is that the reality is that we have to follow the science, that the virus doesn't respond to what we wish it would do. It is the case growth is unavoidable if we don't take the appropriate measures. And when I say case growth, I want to remind everybody that these aren't cases. These are people. These are now people's children, people's fathers and mothers. It is skewing younger, of course, because we do have such a high rate of vaccination in elders. And so we need to do everything we can together, provinces, territories, the federal government, and individual Canadians to protect each other so that we can get through this, get more people vaccinated, and finish the fight against COVID-19. Thank you.
All right, thank you, Minister. Thank you, media, for your questions. This concludes today's press conference.